Good morning. Today is Thursday, April 16th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Today I invited Dr. Christina Lipke and Dr. Dwayne Tull to speak about an important topic affecting our community. Dr. Lipke is Medical Director for the Oswego County Health Department, and Dr. Tull is the Chief Medical Officer for Oswego Health. We're concerned that people are putting off seeking medical care because they are worried about becoming exposed to coronavirus in a hospital emergency room or a doctor's office. I've asked them to share their advice as our healthcare professionals. Dr. Lipke.
Thank you, Chairman Weatherup, for allowing me to share some thoughts with everyone today. I'd like to take a moment just to thank all the residents of the county for doing their part in social distancing. We can tell that everyone is doing their part because the number of positive COVID cases is only increasing by less than a handful a day. This means that our county has been successful in flattening the curve. There are other counties in New York that had their first positive cases the same week that we did, but their number of cases are vastly higher than ours. To me, this means that our residents are, for the most part, really following the advice that has been set before them. They are staying home and keeping their distance. So thank you for doing your part. But today what concerns me and what concerns other primary care physicians that I've heard from is not a growing number of patients who are testing positive for COVID, but instead this growing anxiety and fear that patients have of this virus. And I understand that this fear is very real because every time we turn the TV on, we see these overwhelming images of what can happen to those who catch this virus. We see a growing number of deaths that are being reported in New York City and horrific images of overcrowded emergency rooms and ICUs in New Orleans and Detroit. But it's really important to take a minute and remember that we live in Oswego, New York. Just take a deep breath. It isn't that those things couldn't happen here, but they are not happening here right now. So with this in mind, I want people to know a couple things. First of all, it is safe to get the medical care that you need if you need it. I've had patients who are scared to get blood work or x-rays, and they even come to see me for ear pain or belly pain well, actually they don't come to see me, they're afraid to come to see me because they're afraid of being exposed to the virus. And I know that at our office, we're mostly doing telehealth. This means that our waiting room is usually empty. We have a separate area of the building with a separate entrance where we see patients who have fever or cough. The cleaning procedures for our office, for the waiting room, and other areas of the building are dramatically different now that the pandemic is here. We're doing everything that we can to keep our patients and our staff healthy, and we are not the only office with these new procedures in place. Secondly, it's critically important that if you have young children, especially infants, that you bring your kids in for their vaccines on time, even during this pandemic. One of the things that I'm personally fearful of is seeing vaccine-preventable diseases like meningitis in babies again. And I haven't seen these things since medical school, but I'm worried that we could start to see them again. Like other offices, our office has a separate entrance now for well babies and a designated well baby room with separate equipment just for your little ones so we can keep your baby safe. And we aren't the only ones doing this. And lastly, I need people to remember that there are more common medical emergencies than COVID-19, like heart attacks and strokes. So please, if you have chest pain or if you're having stroke symptoms, don't call your doctor for those emergencies, call 911. There are things that can wait, like a cough, but there are things that cannot wait, like if you're having severe chest pain or severe shortness of breath. Don't be afraid to get the medical care you need, and don't let your fear of this virus get in the way of your health.
Dr. Lipke, Chairman Weatherup, thank you for letting us join today. I too want to echo the message that there are medical problems that need care even in this fear of COVID. Oswego Health wants you to know we are working to protect everyone and are available to our community for your general health needs right here at home. Even with COVID-19 concerns, people will still need medical treatment, have difficulty with medication management, need lab work, x-rays, and other health concerns that must be addressed. You can have the confidence that it is safe to seek health care and that our healthcare system is very capable of meeting your needs in these unique times. To reduce the risk and increase the safety of our staff and patients, Oswego Health has implemented telemedicine across our primary care and specialty services. We have implemented protective masking for all of our staff, and we encourage you as patients to wear masks when you come in the facilities. We've created separate waiting rooms in both urgent care sites and our emergency room to separate respiratory illness from other illnesses. We also are in the process of trying to set up an outdoor triage center with the capability to treat those respiratory patients in an isolation area on our main campus. Please remember, don't be afraid to visit your doctor, our hospital, or urgent cares if you need treatment. We do still suggest calling ahead if it's a routine problem or something that needs to be screened to an appropriate location. If you've been sheltering at home, this is very important. Call your PCP if your symptoms are worsening. It is much better to seek early intervention than to wait until the problems and illnesses can become a tragedy.
Thank you, Dr. Tull and Dr. Lipke. We've said this many times over the past few weeks, but I can't emphasize it enough. If you have questions about COVID-19 or possible exposure, please reach out to your healthcare provider or call the County Health Department's COVID-19 hotline. The hotline is staffed from 8:30 a.m. to 4 p.m. 7 days a week. The number is 315-349-3330. Thank you for staying the course and helping to prevent the spread of COVID-19 in our community. Remember, people can carry this virus and not have symptoms. They may not know they are infected. That's why social distancing is so important. For more information, please go to health.oswegocounty.com/COVID-19 for the latest news releases, daily updates, and video presentations, or visit oswegocounty.com. We're all in this together, and once again, we appreciate your continued patience and cooperation.